Good afternoon, everybody. Welcome to today's Facebook live session. Today's topic is going to be sinusitis. To explain about sinusitis and much more, we have with us Dr. Shyam Kumar, ENT specialist and head and neck surgeon at Apollo Heart Center, Thousand Lights, Chennai. Sinusitis is a very common problem amongst which a lot of us face, but most of us are not aware of the symptoms and how to get them treated and get it rectified. So to explain about this, we have a doctor. So we'll just go on to the doctors. Please share your questions if you have any. So we'll just connect with the doctor right now. Good afternoon, doctor. Welcome to the session.
Good afternoon.
The first question is, what is sinusitis, doctor?
Well, sinusitis basically means there is inflammation or infection in what is called as sinuses, paranasal sinuses. Our facial bones have hollow spaces inside, which helps make it lighter. But these spaces have a lining and they secrete mucus. And these hollow spaces drain into the nose through narrow mouths. So when this narrow mouth gets blocked for some reason, allergy or infection, or naturally because of the anatomy, so the mucus gets stagnated, it gets infected, and gives you repeated problems. Because of the stagnation and infection, you have this heaviness, pain, headaches, nasal discharge, and phlegm dripping down your throat, and all these sort of symptoms. And then some people have cough also. So these are the various common symptoms of sinusitis.
Most of this refer to like common cold. Like if somebody has common cold, they face all these symptoms. So is it different from that, or sinusitis is a specific condition?
Sinuses are extension of your nose, so it doesn't happen alone. So the nose is called, if it's inflammation in the nose, it's called rhinitis, and along with that, the sinuses are called rhinosinusitis. So any infection, when it happens, like common cold, viral infection, or bacterial infection, usually it runs a short course for a week or 10 days. So it's called acute rhinosinusitis, which is medically managed. Okay, so when these things go haywire, when the treatment is not sufficient, or patient has got other problems because of which the infection doesn't clear fully well, then it goes on to a longer phase called subacute sinusitis. And even then, if it doesn't get better, then it goes on to a stage called chronic sinusitis, which is what we commonly refer to as sinusitis in common parlance.
Thanks for that. So is it like a very chronic problem, or is it something which can be easily treated, doctor?
Well, we are seeing more and more patients thanks to, what shall I say, a lot of allergies. Allergy is one of the predisposing causes for sinusitis because it causes swelling inside your nose and sinus lining, which, like I said, if the draining mouth area is very narrow, when there's swelling in that area, it gets blocked. So that will predispose you to develop sinusitis. Pollution, again, cause irritation inside the nose and sinuses. That can again lead to problems. Okay, so as a whole, yes, we do see a large number of patients with sinusitis, yes, in urban population, yes. It also happens in rural population. And there are different forms of sinusitis. Okay, so and lack of ventilation, sunlight, all these things play a big factor in the sinusitis going on to become a chronic sinusitis.
So what are the other causes, doctor? So could it be like a viral infection or a bacterial infection which could cause an
Commonly, yes, it starts with a viral infection or a bacterial infection, and then you rarely have fungal sinusitis also, which has become more relevant these days. Fungal sinusitis we see in immunocompetent or normal people. And we see in immunocompromised people, people with liver problems, kidney transplants, diabetics whose diabetes is not very well controlled, people with HIV or these sort of problems where the immunity of the person is very compromised. So all these things are also becoming very significant nowadays. All these three can cause sinusitis. Like I said, it generally starts with one, and then if it's managed sufficiently well and with adequate medication and precautions from the patient's side, then that particular episode may subside. If it is ignored or if it's not treated adequately, then it leads to more problems.
So coming to the treatment for sinusitis, is there like a complete cure sort of treatment which is available, or is it done based on symptoms and on an episodic basis?
Like I said, first the diagnosis has to be made properly. Number one, if diagnosis is not made properly, then of course, we see many people who have been treated, who have migraine, who get treated as sinusitis, they never get better. So first of all, the diagnosis has to be correct. Okay, if you're treating some other condition as sinusitis, it's never going to get better. So it's very, very common for people to confuse migraine and sinusitis. Okay, so That way, nowadays even migraine is frequency is pretty high with stressful life. So very commonly confused condition is migraine. So the distinction has to be made properly from the beginning. Most sinusitis is medically manageable, and then if treated adequately with adequate duration of medicine and like precautions, then it gets better. Failing which, then we do an imaging and see what is actually going wrong with the sinuses, why the particular patient's sinusitis is not responding to medication. And we assess the sinuses radiologically, see what's happening inside the nose. If this is persistent accumulation of mucus, or the lining has become irreversibly damaged. If the damage is not, if damage is reversible, then you give medication that goes back to healthy state, patient gets better. Sometimes the damage is too much, and the epithelium or the lining on the inside, the mucosa undergoes irreversible damage, which causes more problems. So that needs to be assessed on the imaging after medical treatment. We look at the inside of the nose, the draining passages. Like some people have what's called a deviated nasal septum. If to an extreme degree, it can compromise the airway on that side, ventilation on that side of the sinuses will be compromised. You have normal folds of tissue inside the nose, which may be make it bulky, or they may be blocking the passages themselves. You have other things happening there. Sometimes, very rarely, people have some bony benign tumors, which can cause blockages to the sinus mouth and then cause problems. Some people have fungal material accumulating inside the sinuses, so they will respond to medication, then they'll have symptoms. So because until the fungus comes out, the problem does not settle down fully well. So all these things, initially we give a course of medical treatment, patient gets better with that, end of story. If they still have problems, then we do imaging. Like the gold standard for checking out the sinuses is CT scan of the sinuses. X-rays are done, but then X-rays are only 50% accurate. So it would be a great compromise in assessing the sinuses by doing an X-ray.
You mentioned about confusing sinusitis with headaches,
Yeah,
migraine.
Yeah,
and it has got a lot of symptoms in common with like common cold and something which we normally face.
Yeah.
So how does one differentiate migraine or other conditions from sinusitis, and is it something which the patient can do it themselves, or do they need to approach a doctor?
Being almost 20 years in this profession, sometimes I myself find it difficult to make the distinction. So I would really ask the patients to take professional help and not to rely on some shortcut. Okay, so that is the number one thing. Of course, generally in migraine, you will not be having nose blocks. You will not be having the thick phlegm or secretion coming from the nose. So that is more in case of sinusitis. But then a patient can have two conditions. It's not necessarily that a person has only diabetes or only hypertension. They can have both. Likewise, a patient with headache can have both migraine and sinusitis. So the question then remains, which one is predominant and which is causing more problems? And the patient has to be treated accordingly. That is to be the judgment of that is made by talking to the patient and examining the patient. So that's why the doctor's role is very important in this.
Okay. So there's another question which one of our viewers is asking about nasal endoscopy. So what does nasal endoscopy mean?
See, the way we diagnose sinusitis is, of course, clinically we examine the patient, we look at the symptoms when they talk to them, and the third way in the OP or in the clinic how we diagnose is we use what is called as endoscope. Endoscopy basically means looking inside the body. Okay, so basically we use a thin a glass rod telescope, which we under local anesthesia pass inside the nose, and then when we try to look at the mouths of these sinuses from where these secretion comes out, and see what is happening in those areas. So we could see, like I said, some people, because of allergy, they could have what is called as polyps. So if there are polyps there, you could see polyps. If the sinus is infected, you could see frank pus coming out sometimes, or you see thick secretions. You see the lining is thickened up or it's swollen up, and there are changes in the anatomy on the inside, which is blocking the passage of the sinuses. So all these things can be assessed on the endoscopy. The endoscopy cannot look inside the sinus. Until the sinus is opened surgically, you cannot look inside it. So endoscopy is one of the ways of assessing it in the OPD. The gold standard for diagnosing sinusitis would still be CT scan.
Okay. These infections which you talked about, doctor, which cause sinusitis, is there some way where we can avoid it, like common conditions, common scenarios where somebody could get infected?
Most of these are respiratory infections, so they spread by air. With the use of air conditioner in offices and schools and other places, unfortunately there's lack of fresh air, so it's just recycled air. So if you could get fresh air, that's the number one thing that could help you reduce the incidence of sinusitis, number one. That's why in the beginning you said lack of ventilation. Okay, so that is there. Of course, sunlight as a natural UV light has got a disinfecting property. So when you have centralized AC or other things, automatically sunlight is again cut off. So most people will lack these two things. Once they get these two things, the amount of sinusitis automatically comes down. The third thing is allergy, and most allergy is to indoor dust or house dust, because of which people have problems. So what we would suggest is to follow precautions for reducing house dust exposure. Like instead of sweeping and mopping, we would ask them to do wet mopping directly, or use vacuuming at home, and wet mopping for dusting at home, not dry dusting or vacuum. So these are common precautions that can reduce the uh, incidence of sinusitis. Okay. Apart from that, yes, of course, if you have somebody who's got an infection, they can try to use a mask so that they don't spread the infection to others. But most sinusitis will start with acute sinusitis, like I said, like a common cold. If it's left untreated, if it's a little too much infections, a little too much, and they're not treated properly, then it goes on to chronic sinusitis.
So you were talking about wet mopping and avoiding vacuum cleaning. So is that due to the dust and the allergy?
Yeah, house dust is like I said, it's the commonest cause of allergy, and 80% of house dust comes from a skin. The dead cells from a skin constitute the 80% of house dust, and on that you have a mite going called house dust mite, which causes allergy. So to control that, we use vacuuming and wet mopping. Okay, so to don't let it fly up. That is the basic model. Okay. Apart from that, yeah, people have allergy to certain items. Like in food, people could commonly be allergic to raw tomatoes, brinjal or eggplant, bananas, guava, and sometimes citrus fruits. Food color is one common cause of allergy, like in soft drinks and pastries and sweets. Apart from that, in non-vegetarian diet, if you look at, sometimes people have allergy to seafood, and maybe rarely prawn and crab, and then egg also sometimes. So these are common things that people could have allergy to, but then each person may have allergy to some specific item, so which they could do an allergy test and identify and then try and avoid that. Or if they have multiple allergies like skin allergy, nasal allergy, asthma, but multiple problems for which they need medication, then we would ask them to undergo what is called the desensitization, wherein the patient is given an increasing dose of the allergen till they form what is called as blocking antibodies. That reduces the allergy in the patient. So that is one way of treating it, but it's a longer course of treatment which may last up to 3 years.
So to identify the allergy, does an allergy test actually help, doctor?
Yeah, most of the time, the allergy test helps you identify the allergen, but we don't have allergy test for everything on this planet.
Yeah.
So there are certain things that we may still not be able to identify on the test. So like I said, the common cause of allergy we know. So these are things that commonly cause allergy. So likewise, when you do a test, we see what all the allergies patient have, and then we treat them for at least about 5 different allergens at a given point of time.
So which is a broad range.
Yeah. So it's a most we look at the allergy test reactions, and we decide like which the top 5 which have the maximum reaction. We treat them for those 5 allergens at a given point of time.
Okay. When is surgery required, doctor, to treat sinusitis?
Yeah. Number one, like I said, if a patient has had adequate medical treatment, number one, and then failing which he still is symptomatic, still has problems, we do a CT scan and see what is happening on the inside. And if this still shows significant problem in the sinuses with a lot of accumulation of mucus and irreversible damage in the lining, then we would go for surgery. That is for the immunocompetent patient. For immunocompromised patients, we have a lesser threshold because they may not have the typical symptoms of normal people. So they may not show too many symptoms, but the damage on the inside may be much more. So what we would do would be, we will be more aggressive in treating those patients. We would like to do an imaging much earlier and see what is happening, what is going wrong when they have even subtle symptoms. If they early on in the problems, they may have subtle symptoms, but the damage on the inside may be much more compared to the normal person. So for them, we'll be more aggressive in treating, looking at this thing. And once we find out what is actually happening, there are this sinus surgery is not just one this thing that it says, okay, what we do is now endoscopic surgery. So endoscopic surgery, but then we look at what's actually happening on the inside, and depending on how much problem is there. Say a patient has got only one particular sinus which is affected. So nowadays we have what is called balloon sinuplasty, which is the latest for sinus treatment. So if there is if there's a blockage in one draining passage of one particular sinus, we could just do a balloon sinuplasty, open up that passage like doing an angioplasty, and then help that sinus get better. Okay. Uh, the next step would be to look at polyps and other things which are gross, bulky disease that is there, which is blocking the passages. That we would operate under endoscopy with the help of a special device called a microdebrider. which would help us give much better results to the patients, so that they don't have recurrence of these problems. Okay, and patients who have a very extensive disease, where the anatomy itself gets altered by the disease, then we use what is called as navigation, so that we don't the sinuses are in close relation to your eye socket, the orbit, and above that is your brain. So in some places the bone is pretty thin, it's about half a millimeter or millimeter thick some places, so it can be pretty thin in some places. So, and because of this polyps or fungus are sitting over there, the bone may get thinned out. So in that situation, when as we keep removing the disease, the position of the normal structure may vary. So in that situation, we like to use navigation and make sure we don't end up in the wrong place when we operate. Okay, so that will help us improve the safety and help us clear the disease also much better.
So what should one expect during surgery, doctor, if somebody is on the verge of getting operated? Is it like a day care procedure, or how long do they need to stay at hospital, and how long would it
Most
take?
sinus surgery is a day care procedure mostly. Like I said, for this very extensive disease or some we expect say a lot of bleeding is there because some reason or some other problems are there, then we would ask them to stay back in the hospital. But vast majority, more than 90% or 95% is day care surgery, and it's done under mostly general anesthesia. It can be done under local anesthesia, but it's not a very comfortable experience. So general anesthesia is more comfortable to the patient and to the surgeon also. So and it's an endoscopic surgery. There are no scars on the outside, no incisions, nothing. And once we operate, most of the time we would keep a dressing on the inside, which is like a preformed sponge, which would probably typically will keep for about a day. Nowadays we have special dressing materials like hemostatic foam, which we can just spray it on the inside once we operate on the sinuses, which would just stick to that area, and then patient just uses saline drops, and then it slowly melts away over time. The otherwise the standard thing is to use these preformed packs, PVA sponges, which we remove the next day, which can be done in the OPD, or if the patient is admitted overnight, we remove it next day and then send the patient, discharge the patient. Generally, when you operate on the sinuses, as you say, like I said, they have secretion, and the lining is a little special, like your respiratory passage. So these lining has got microscopic hair-like structure called cilia, and the cilia beat in a particular direction in each sinus, and that's how the secretion goes typically to one direction towards the mouth of the sinus. So when we operate on the sinuses, these cilia stop working temporarily. So the normal mucus gets accumulated, and since on the outside you may not see much, but on the inside they'll have a lot of raw area. So there'll be clots on the inside. So we have enormous mucus stagnating and clots on the inside. So the nose will be a little stuffy. The first 1 week or 5 days they'll be a little stuffy. So what we do is we ask them to use medication with which these clots and mucus dissolves and keeps clearing away. And by the end of first week, most people are much better off. And generally, to heal on the inside for an average sinus surgery patient takes about 20 days. So what we would like them to do is not to do any heavy work or strain or do exercises, because they have a lot of raw wounds on the inside. So if they strain, it may start bleeding. So that's one thing we don't want them to do until the sinuses are fully healed well. By 10 days, most of the nose becomes free, and by 20th day, they're really back to almost their normal self, or the better self, the pre-disease self. They come back to their normal self. Sometimes, yeah, if patient who's got very extensive disease or other problems, then we would ask them to come on a weekly basis and put in the OPD and the local anesthesia. We'll just see what is happening on the inside, how the healing is taking place. Sometimes no healing takes place. There may be bridges forming and blocking the mouth of the sinuses called adhesions. So we like to release those before they completely become mature. So we may want to make sure that those sort of things don't happen, so that sinusitis does not recur. Okay, so sometimes we may have to ask them come on a weekly basis for 2-3 weeks until the healing is complete.
So can they return to work immediately, or do they need to stay at home?
Well, if they're not doing any heavy work, they could probably go back the second day or third day. Okay, so they could go back second or third day, and then by the end of first week, most of them are already back to work.
Okay. Are there any risks associated with the surgery? Something which they need to be concerned about?
Well, no surgery is risk-free. So all surgery comes with some form of risk attached. Of course, it depends upon the doctor and the patient. The patient's expectations have to be realistic, and the doctor's has to be trained, and he has to be aware of all things. Like I said, that's why we use CT scan to initially look at the sinuses and see what all problems are going on the inside. And we use the CT scan like a roadmap. when we operate on the sinuses. So that's like a map for the surgeon to tell us, okay, I should not be going here, or I should be going here, I should not be doing this. So that CT scan needs to be assessed really well, number one. Even then, sometimes, like I said, the bone is pretty thin some places. So even if the surgeon is careful, despite that, sometimes people do have problems. So the two most vital areas that are next to the sinuses are, like I said, your orbit, the eye socket, and your brain. So sometimes what happens, the bone between the eye socket and the sinus is very thin. So there's fat around the eye socket, in the eye socket, which may just collapse into or fall in, just bulge into your sinuses, which generally does not give too much problems. Only the thing is they may have a little eye pain when they move their eye because of that. Of course, we do see instances where, unfortunately, some surgeon has really gone into the eye socket unknowingly, and that does lead to some problems. Okay, sometimes they can have double vision because of that. Very, very rarely, I think a patient can lose vision also, very rarely. But nowadays, it's not very common for that sort of thing. It's very, very rare for that sort of thing to happen. So I would say it's like getting struck by lightning. So just because somebody can get stuck by lightning, people do not stop going out of their houses. So the standards have improved these days. So that way, these things are very uncommon. The second thing is, like I said, the bone between your brain and sinuses is very thin. So if there's a damage in that area, sometimes what happens is there's a fluid around your brain in which the brain is floating called CSF. So that would tend to leak. So depending on the size of the leak, the treatment is done. So if it's not too big, we would probably not even do anything. We'll ask the patient to take rest, put them on medication, and it will just close on its own. Okay. If the leak size of the defect is big, then we will do, at the time of surgery itself, we will do some repair. So which would typically take some tissue from the nose itself, or very rarely we'll take tissues from the thigh and plug the defect and close it off. And that would entail taking rest for about a month. So if that sort of situation is there. So sometimes, because of, like I said, polyps and fungus, they could be actually hiding all these things behind them. So only when you take it off, then you would see. So it's not that it's the surgeon's fault always. So this disease also creates problems, especially when you have fungal sinusitis. It can create problems like this. So once the disease is removed, then it creates problems. So until then, the disease itself is holding things in place. Okay. So but the disease needs to come out. So when it comes out, sometimes it is already taken off the bone behind it. So when you take off the disease, then only you see this defect. So otherwise, we'll have to do CT and MRI for every patient, which will be very expensive, and it will be over testing. So not really necessary for everybody. If we suspect, like sometimes we do ask patients to get both when we suspect problems. So if there's no suspicion, or there's no other, it's a routine sort of thing, then we will not ask for this thing. We will just do a CT scan and proceed.
Sinusitis, if left untreated or if it's not detected at an early stage, does it cause any complications or any other health problems?
Yeah, see, sinusitis, like I said, acute sinusitis is medically treated. So it has to be treated completely and properly. Otherwise, of course, chronic sinusitis, like I said, it gives you headaches, nose blocks, runny nose, the secretion dripping down the throat, causing cough and all these sort of things. So first of all, it generally tends to affect your quality of life. So it gives you a general sense of ill health, and people don't feel well. They feel tired constantly because there's always some infection festering, sitting inside their sinuses. So the general quality of life goes down, number one. And of course, when your nose is stuffy and blocked, the sense of smell goes down. There's reduced enjoyment in food, and flavor is missing. So again, quality of life goes down. As time goes on, when sinusitis is left untreated, of course, the sinuses are blocked. You have infection inside, sitting inside. It now starts looking at place to spread. So, like I said, again, the two most close neighbors are your eye socket and your brain. So, yes, very rarely we do see that, and sometimes, yes, in children also we see that the eye socket gets involved. So, in that sort of situation, we need to do an urgent operation to save these areas from further damage. So that can happen, yes, and even then they'll need medical treatment. So sometimes when you do an emergency surgery for these sort of things, it is just to address that problem at that particular point. So we would not do a complete procedure. So maybe they'll need a second procedure later on when they're much better off. When the patient is sick, we would just do a limited procedure to salvage the situation, and then we would go back a second time and do the complete procedure. So that's what is generally followed. With regards to the brain, yes, you could still have infection spreading to the brain, which can cause symptoms like meningitis. You can have brain abscesses. So all these sort of things are there. So when this happens, then of course the primary focus on treating the brain-related problem, that is treated by the neurologist or a neurosurgeon, and then the ENT surgeon comes into picture, and then we clear out the disease.
So it's essential for them to get it treated.
Definitely yes, definitely yes. Sinusitis should not be left untreated. And today's, especially with India being the diabetic capital of the world, with diabetes and sinusitis, especially if you have fungus in the sinuses, it can be very nasty. Fungus has got a unique this thing because the nose is open to the outside, is always accessible to the fungus. It presents in various ways in us. And if for immunocompetent person, it could be just sitting over there, not doing anything. The next level, it could be the fungus alone could be growing without doing anything, what is called as a fungal ball. The third thing is the fungus is sitting there and giving you allergies and sitting and irritating your mucosa, and leads to formation of polyps. It's called chronic allergic fungal sinusitis. The next way it can present in some, if a patient is not very immunocompromised, but yes, sometimes in immunocompetent as well as mildly immunocompromised patients, it could be slowly destroying tissue. It's called chronic invasive sinusitis. In very poorly controlled diabetic patient who's got very high sugars, or kidney failure patients, or patients who are on immunosuppressants like post-transplant, in those sort of patients, the fungus can move very quickly. Within days, it can spread from your sinuses to your eyes to your brain, which is called acute invasive anocerebral sinusitis, which could be life-threatening. It's not treated if it's not detected early enough. So definitely yes, with people having a lot of diabetes, I would be very, very keen that people who especially with diabetes, be sure that their sinuses are very well sorted out.
Thanks for that, doctor. I think we've covered sinusitis in a very extensive way. Thanks for explaining these things to us. Since we are on the topic of ENTs, I just thought I'd ask some general questions about ENT, like about ear maintenance, because there's a lot of ear infections which happen, and as you said, like I've heard cases where ear infections have passed on to the brain and affected. So how could one generally maintain ear hygiene, and do you need to like actually manually clean them, or are ears like self-cleaning?
The ears have a natural self-cleaning property. The wax is formed in the depth of the ear canal and slowly pushed out by your body. Okay, so theoretically, yes, your ears don't need any cleaning. Okay, so by many people use cotton buds and all sorts of things to clean the ears out, which is not advisable. It would generally push the dirt back inside, and over time, it will help more of dirt accumulate. Plus, it's a source of irritation to the ear canal, which will tend to produce more wax because of that. And we do see patients who keep doing this on a daily basis, and then they land up with problems like skin condition called eczema in the ear, where the ear is constantly itching, and they have repeated episodes of infections, pain, and then they need more higher antibiotics and treatment, and then again after some time again. So the first and foremost thing is to not to fiddle with the ear, just leave it alone. Number one. Number two, if at all you want to do anything, you just first get your ear checked out by the ENT surgeon. Make sure the eardrums are intact. Once the eardrums are intact, and if you're otherwise okay, do not do anything. You could just probably use wax softener drops that you get over the counter. You could use that. That will make the wax soft, and the ear wax would probably keep coming on its own. There are a lot of confounding factors in this sense. In this, if you spend a lot of time in AC or extreme temperatures, the wax gets dehydrated, so it will get thickened up and get accumulated. If you have skin problems like dandruff or psoriasis or something like that, again the wax will become hard. Okay, so there are other factors also. So that way, if people have these sort of other problems, they would definitely need help. They maybe yearly once or something, they'll have to go visit the ENT surgeon and then get the ears checked up and cleaned by the ENT surgeon.
Thanks, doctor. You had mentioned about deviation of nasal septum.
Yeah.
So is it a surgical process to correct that, or is there any other process where it can be
corrected? A deviated nasal septum is a structural problem. If and most people will have a deviated nasal septum. The question is whether it is actually connected to the problem. So again, that's where the doctor's judgment comes in. So if the doctor's judgment and the radiology or the imaging suggests that the deviated septum is causing the problem, then we need to correct that. So just because somebody has got deviated nasal septum doesn't need to be corrected. Question is whether it's actually connected to the patient's problem. So the doctor has to make the judgment.
So if there are some symptoms which the patient faces, then
most commonly, yes, it's like a nasal block or a stuffiness on one side of the nose, and sometimes very rarely they'll have headache also because of the septum itself. Because if the septal deviation is to an extreme degree, it can go and touch the side wall of the nose, wherein then there's because of the septum being pretty sharp and pointed and touching the side of the nose, it can impinge on certain nerves and cause headaches. So that in that sort of situation, yes, by just doing a simple correction for the deviated septum, the headache also gets relieved, which is called the contact headache.
And what about nasal bleeding, doctor? Is it what causes nasal bleeding?
It's a very common problem. It occurs in almost all ages. Okay, and the most commonest cause of bleeding from the nose is what is called as nose picking. So people, they again they keep fiddling with their nose. They like to clean their noses. So that what that causes, the nasal lining on the inside, the front of the nose on the septum is pretty thin. So that causes trauma, and because of that, they may not bleed at the same time, but it may cause small wounds over there. And when the BP rises for some reason, then they start bleeding. So, or if a child has got a cold, and because of which there's already normal higher blood flow is there, and then there's some minor trauma, they start bleeding. And older people with hypertension, what would happen is when the BP rises up, the blood vessels in your nose lose their normal elasticity, so they become more brittle like glass, and they tend to break when the BP rises, and then it bleeds, which is good in a way, because I like to call it the nose, the safety valve for your cooker. Okay, so if the safety valve works, the cooker does not blow. So many a times it is the nasal bleeding that brings attention to higher blood pressure, and then patient gets treated for that, fortunately. So if it's missed out, then they have bigger problems. That is the common cause of bleeding in the nose. Apart from that, there are other reasons. Even polyps or some infections also can cause bleeding from the nose. Rarely, yes, in smokers, we can have tumors or cancers going inside, which can cause bleeding from the nose. So these are some common causes of bleeding from the nose. Trauma, of course, we do not say.
Another condition what we commonly hear these days is sleep apnea. So what is sleep apnea, and how does it affect one's lifestyle?
Sleep apnea basically means that the breathing during sleep is getting disturbed, number one. So there are a number of factors why sleep apnea happens. There are a number of types also. The most commonly what we see is obstructive sleep apnea, so which is basically a block in your upper airway from your nose up to your voice box level. Anywhere from here to here, there's a block, because of which people tend to snore, and they'll have the airflow gets reduced. So that is what is called as significant reduction in airflow, or stoppage of airflow for more than 10 seconds is called sleep apnea. Okay, so in this, the nose is the first part of the area where the breath has to go in. So if you have sinusitis, allergies, polyps, which is actually blocking the nose, so the nose is not working. And the nose is not just a normal, just a tube where the air just blows through. Nose has got a very important function. It conditions the air to suit your lungs. So it has to, if it is cold outside, it has to warm it, humidify it, and send it to the lungs. If it's warm outside, it has to cool it down and then again send it down to the lungs. Plus, you have some reflexes called nasobronchial reflexes. When airflow flows through your nose, it triggers a response in your lungs, so which makes your airway more responsive to receive the air. So when people don't breathe through nose and they breathe through mouth, this part is lost. So even though they're breathing, there's a lot more resistance to their breathing. So they really have to struggle to breathe. That is one of the reasons when you mouth breathe, you struggle. Okay, number one. And the second level, this is the first level of obstruction in sleep apnea, is the nose. The second level is your soft palate and your tonsils. The soft palate, in Tamil commonly is called ulnaku. So for many people with sleep apnea or the snoring, the soft palate may be a little bulky, longer than usual, and thickened, and tonsils may be a little bulky in size, so it would crowd the airway. So again, it will be floppy. So when they're sleeping, it will just flutter and then cause that noise. Okay. The third level is the back of your tongue, which you cannot see directly. So the tongue goes like that and then turns almost 90 degrees. So the back of the tongue has also got it's got two parts. One, the layer on the top covering called lymphoid tissue, and this muscle. So either of these could be big. So it could be a combination of both. So that way, the back of the tongue and the back of your throat may be very close, because of which the airway gets narrow. And the tongue, when you sleep especially, tongue is mostly muscle, and it becomes floppy and just collapses if you're especially lying down straight like that. So that will cause blockage in the airway. So sometimes people will just literally choke and sleep and gasp like that, and then again they'll start breathing. Sometimes some people have to sit up and sleep because they're choking too much. So the tongue is constantly falling back. Okay. So all these symptoms put together will affect your breathing, and over a period of time, it needs extra work for your heart and lungs. That leads translates into blood pressure, fluctuation in oxygen levels will change your metabolism, leading to diabetes. And every day in the long run, when your heart is doing a lot of extra work, it leads to higher risk of heart attack and stroke, about 30-35%. So that way, yes, all these things are connected. So sleep apnea is again an increasing problem, and vast majority of people are overweight. So the first thing we want them to tackle is weight. And of course, if they have anatomical problems like they have sinusitis, they have allergies, we treat that with medication or surgery as and when required. And then we do a test called sleep study, which looks at their breathing during sleep. And we look at various parameters in that and to assess their breathing. And if the breathing is really getting affected to a medium or severe degree, then we start them on treatment. The frontline treatment for that is what is called as a CPAP machine. It's basically a machine which just monitors, in very simple terms, you wear a tight fitting mask, which is kind of a tube to the machine, and this machine is monitoring your air breathing, and the airflow goes down to a critical point, it just pushes in air. This is just a very oversimplification of what actually happens. So thereby the machine makes sure your breath is maintained. So when the breath is maintained, all these other consequences of that not breathing well are taken care of. This is the ideal sort of thing. But there's nothing ideal in this world. So even then, people do have issues. So but this is the frontline treatment for sleep apnea world over, and we ask people to use this as much as possible. For some reason, if the patient is not able to use the machine or is not willing to use the machine at all, then we look at doing surgery for these sort of patients. Okay, so there are various surgeries, and we look at the combination of issues, and the vast majority of the patients, there will be a multi-level obstruction. There may be more than one level. So just by doing one particular area, think problem may not get sorted out. Very rarely, yes, you'll have one level problem, like somebody is born with a small jaw. So for them, if you do corrective jaw surgery, they may get really very well. Okay, so very few people, minority of people have that one level issue. Majority is multi-level.
So there could be various causes.
Yes. So it's about three areas where there could be problems. Of course, the nose is one of the areas which is contributory. The contribution of nose is a little lesser than compared to what your soft palate and tongue is. But then the problem is, if the nose is not corrected, nasal breathing does not start. Like I said, nasal breathing doesn't take place, they have more resistance to breathe. So that way, in some centers, they would routinely correct the nose and then put the patient on CPAP. We would probably be more not so aggressive. We would ask them to use CPAP. They're able to use it successfully. Just leave them with that. Okay. So with that is that.
Thanks, Doctor. Thanks for answering the questions patiently.
Yeah.
We've come to the end of the session. If you'd like to end with a message to the viewers, you can do so.
Definitely, yes. We see a higher incidence of smoking and other things which contribute to sinusitis. Definitely, yes. So if you are a smoker, please do give up smoking. That is the first thing we would like you to do, because without which medication or surgery also will not work. So smoking is a strict no-no for sinusitis. Not only sinusitis, for all other health problems associated with smoking, we would like you to stop first. Without that, medication does not work fully well. And of course, if you do have sinusitis, please meet your ENT surgeon. Make sure you get adequate treatment, and please be realistic and patient to get your results, and give your doctor time to treat you. Don't be in a hurry for quick short results. There are no shortcuts. There are no quick short way of getting things done.
Thanks, Doctor. Thank you so much.